Most commonest symptom of breast cancer is a painless lump in the breast. Painless lump is seen in more than 90% of women who come to us with breast cancer. It does not mean that every painless lump is a cancer. We have to evaluate between lumps that happen because of hormones or because of periods versus lumps that are actually dangerous. So, if there is pain in the lump, it is pointing more towards trauma or an infection. Most likely, it is almost always a painless lump, either in the breast, or some women who have not seen the lump in the breast, they come with the same painless lump in the armpit, where the breast cancer would have spread. So when she comes to me with the painless lump in the armpit, the first thing I'm doing is checking her breast to see if there's any lump that she has missed. Secondly, after the lump is the other common symptom, which is nipple discharge. Now, Google says nipple discharge means breast cancer. Nipple discharge necessarily does not mean breast cancer. The most significant symptom for me as an oncologist is spontaneous nipple discharge. Any woman who's had children, who's breastfed her children, the milk ducts become slightly bigger in size. So if she constantly keeps expressing or pressing, eventually because of infection there will be a little discharge. But that is completely insignificant for us. If a woman comes to me saying, ಇವತ್ತು ನಾನು ಬೆಳಗ್ಗೆ ಎದ್ದಾಗ my t-shirt was soaked from the nipple, or yesterday I came back from work, my bra was soaked with discharge, that is most significant. Nipple discharge is not significant if it happens due to any itching or any expression. It is always the spontaneous nipple discharge that is the dangerous one. In late stages of cancer, wherever there is a lump, there is also a dimple that's seen on the skin. Again, in India, why I have put this point specifically is because we've had lots of women who come to me thinking it's a skin problem, saying that my skin has got dimpled here. Underlying, there is usually a lump. These are most common signs of breast cancer. Most commonly, it is hardening or a lump in the breast. Sometimes there's erosion of the skin. Sometimes there's dimpling, pinching of the skin on top. Puckering, which looks like an orange peel, decayed orange peel. There will be pits on the skin of the breast. When I say this, please understand and please note that these are all very recent changes that have happened, maybe in the last 3 to 4 weeks. It has not been there forever. If you know your breasts well, like madam was telling, we know how our body is. We know what our breasts feel like. We know what the skin of the breast looks like. Whatever changes I'm telling are all very recent changes. That is what I was telling you about. On the left breast, you can see those pits of the skin present. That is typically known in French as peeled orange anta helteve. This is a classical sign of stage 3 breast cancer. So the next slide I'm going to show you is slightly disturbing. I picked that slide because I'm talking to a group of teachers and I'm trying to differentiate between awareness and education. It does not mean that uneducated women are not aware of a lump in the breast. It does not mean that all educated women who come to me will always come to me in early stage. So I will just put on the slide for 2 seconds and I will change this. Please don't get repulsed. This one. Now, she was the principal of a college very close by to Bangalore. She came to me with this kind of lump. And when I asked her why she didn't come, she said because there was no pain. I just left it like that. So eventually, yes, she succumbed because she came very late. The lump had already formed an ulcer and it had already spread. It is stage 4 cancer. We lost her. But imagine being the head of an institution, knowing what it is, and then not going to a doctor because you feel that this can't happen to me. Nangidagala anta. And that is typically how all of us are. I'm not saying I'm any different. But Indian women, we have this terrible tendency to push ourselves back. Our work is important, our children are important, our family is important. And after everything else, there is some problem that we are just constantly pushing and postponing. It can happen to anybody, but the earlier you come, the maximum amount of cure rates that we can give. A nipple discharge can both be bloody and watery. Watery discharge is more significant than bloody discharge. Bloody discharge can also happen if there is a lump that is not a cancer. Watery discharge is not at all normal.
Subscribe now and press the bell icon. Never miss an update.